So it is the morning of my procedure and I am ready to go. I already thanked my boobs. I thanked them for feeding my children and they've served their purpose. Now it's time for me to have smaller boobs that fit my body. All right, so it is the morning of the surgery and it's COVID-19, so I'm wearing a mask. My husband is wearing a mask. He is here. He will be driving me home afterwards and taking care of me. How do you feel?
The birds are chirping, nice and peaceful. All good signs. We heard a nice little gospel song on the way in. It's gonna be good.
All right, so I'm ready. Let's go.
Let's go. After you, dear. Sweet 400, that's where we're supposed to be. How do we get in?
No. There's a lady right there. Okay, let's see. All patients and visitors coming in.
Arlene's last thoughts. Well, we'll get your last thoughts before you go under.
I'm just ready. I'm just ready.
Is someone coming?
No.
Maybe they'll let me wait here. Look at her wrist jewelry is real now.
Ready.
Now just waiting for you to check in and for them to kick me out. Names.
All right, I'll see you later. It's about to go down. Next time you see me, I'll have smaller boobs.
I'll lift you up in here.
Hi everyone, so I just had my surgery a few hours ago. Everything went well. I arrived at the surgery center at about 5:15 a.m. and then my arrival time was 5:30. I did some paperwork, I paid the money, and then eventually a couple nurses came and took me back. I had to wear a mask in the building because of COVID. My husband came in the building with me. He wasn't allowed to stay in the waiting room at the surgery center, but he was able to stay on the first floor. So that's what he did. They took me back and they got my vitals, so they checked my weight, my temperature, and then my blood pressure and everything. I had to do, because of my age, I had to do a pregnancy test also. I was afraid that I wouldn't have enough pee because I wasn't allowed to drink anything or eat anything after midnight. But I managed to get some out, so I was surprised there. Of course, it was negative because I'm not having any more children. But then after that, they had me put on a robe and they gave me a cap to put over my head. And they gave me these lovely compression stockings, hose, whatever you want to call them. And they gave me some, they didn't give me these socks, these are my socks, but they gave me some other socks to wear. and they gave me a warm blanket, like a legit, like it was like a warmed up blanket, like it felt like it was fresh out of the dryer. But they gave me a warm blanket, and they started my IV, and then hooked me up to heart monitors because I do have PVCs. I was worried about the anesthesia because of my PVCs. I've never been under general anesthesia before, so that's why I was so worried. But the anesthesiologist came in. She had a conversation with me. Everyone at the surgery center was well aware that I had PVCs. My doctor, all of the nurses, and the anesthesiologist. And the anesthesiologist told me that, there's only a cause for concern when you have PVCs if your blood pressure is high. And I've never had high blood pressure, only when pregnant with preeclampsia. But other than that, my blood pressure is pretty, kind of sometimes low, but mostly normal. And then after I spoke with the anesthesiologist, she told me what she was going to do. She told me that I told her I was feeling a little anxious about anesthesia because I've never been under general anesthesia before. And so she told me she was going to give me something for the anxiety. So the nurse ended up giving me Tylenol and Pepsid, and then they put a patch behind my ear for nausea, which I'm not feeling any side effects from the anesthesia at all. And then Versed for, I think that's what it's called, Versed for anxiety. However, I didn't take Versed until right before I went into the operating room. So after the anesthesiologist left, when the doctor arrived, he came and he did some marks on my breasts, to determine where the nipple is going to be moved to and all the areas that he was going to remove. And then once he left, then the nurses came right in and they gave me the anti-anxiety medicine, and that kicked in in 2 minutes. And I remember telling one of the nurses, oh my goodness, I feel drunk. And she said, yeah, it's like having a shot of tequila or something along those lines. They put me in a wheelchair, wheeled me to the OR. However, I don't really remember being wheeled to the OR because at that point, everything is just vague. I think I remember getting out of the wheelchair and walking into the OR and seeing at least 3 people there standing around. And then they told me to get up on this table, which I did. And I feel like there was some kind of purple pillow. It kind of looked like a travel pillow. But I feel like there was a purple pillow and they asked me to lay on the pillow. And then that's all I remember. I don't even remember them, sticking in a needle in the IV, because the way what the anesthesiologist decided to do was, put me to sleep with IV sedation and then use a gas mask to keep me under. So she told me the plan was to put oxygen over my face and then do the IV sedation. And then after that, put some general anesthesia into the mask. And then she also told me there would be a breathing tube down my throat. I don't even feel like I had a breathing tube down my throat. So the anesthesiologist just must be that good where I didn't even feel any of that stuff. And then the next thing I remember is waking up in recovery. There was a nurse next to me. Her name was Maddie. And she said, Naima, wake up. You're in recovery. You did great. And I was like, oh, yes, I made it through the surgery. And I made it through alive because, I was very worried about the PVCs. And, again, all the, the doctors and the nurses were well aware of the PVCs. But they didn't have any cause for concern because my blood pressure was fine, And the anesthesiologist also mentioned she could see my PVCs on the heart monitor. However, she said, but it looks like you're lower than 20%. So I am following up with my cardiologist in August. It's June. I'm following up with her in August to wear a Holter monitor. If you don't know what that is, it's a machine where they, hook you up to, and you have to wear it for 24 to 48 hours. If you're having more than 20,000 PVCs in a 24-hour period, then there's a cause for concern. But, to try to stop the PVCs or minimize them, I started working out. Before COVID-19, I was working out every day. I, slowed down a lot. Right now in recovery, I can't work out. I can't work out for 6 weeks. I can walk, but that's about it. I can't do any working out. But I feel pretty good considering. My doctor also told me that there is a local anesthetic that they inject into your breasts, before he begins the surgery. And I researched one of them and learned that it could have some, some of the side effects could do cause damage to your heart. And then, so I told him I didn't want that one. And he was like, okay, well, we also use this one, but it basically does the same effect. So let me know if you don't want me to use it at all. And then before he did the markings on me, we did have a conversation about it. And, he said about 1% of people might, have heart issues. Like it might cause damage to the heart. I'm not exactly sure in what way it causes damage to the heart, but I decided he basically said only if he administers too much. But because I have PVCs, I didn't want to take that chance. And, he and I came to a decision that he just wasn't going to do any of the local anesthetic. But, which wasn't bad because, I don't feel bad. Like, the part that hurts me the most is just kind of under, the under incision. But even that is probably a 5 on the pain scale. It's not bad at all. I feel okay. I am walking around slowly. You can see I'm propped up in my bed. I'm wearing my button-up PJs. I have a neck pillow. I have pillows propped up behind me. And I'll basically be sleeping like this for at least 3 weeks. I have a compression bra. You can kind of see it. So I have a compression bra, so it's pushing everything in. I did not get drains, and the reason for that is because he uses the compression bra. I am a little swollen. There's my son, Ethan. Hi, Ethan. All right, and Ethan's going away now. But yeah, so the compression bra is really holding me in, and it's supposed to help with the swelling. I wasn't swollen when I left the hospital, but then I felt it when I got home. I, felt it, took a nap, and I woke up and they're a little bit swollen. You can feel it. They kind of look they kind of look like fake, like I had breast implants, but I didn't. I strictly had a reduction, and I'm excited to see what my new breasts look like. I was a G cup, and I told him I wanted to be a small C, and I told him, closer to a B than a D. I don't want to see a D cup ever in my life. That's what I was prior to pregnancy. I was a 34D, and then with pregnancy, I went up to an H, and then I went down to a G. So a G was what I was at. So even with losing weight, my breasts still were big, and they never went back down. And then also my nipples pointed downward, and my breasts were really, really saggy. So all of that was just causing so much pain in my neck, my shoulders, and my back. And I have to say, I can already feel the relief. So I'm glad I did it. Day 1, I feel fine, even without getting, that injection in the breast. So I feel this pain is manageable for me. I don't know if I have a high pain tolerance or not. Maybe I do. But I'm fine, and I'm glad I did it. And I'm just happy that I was able to go through with it, because I was a little bit anxious. Not a whole lot, but a little bit anxious. But I did have faith that I would come out okay, and that I would be all right. And, you only need the faith of a mustard seed. And I definitely had that. Maybe a little bit more. But yeah, so I feel good. I will check in again later. And this is, not even 24 hours after my surgery, just a few hours. So I'm good. Thank you for watching. Make sure you like and subscribe to my channel.